Hi, this is Tom from CareNational, and today we're celebrating National Case Management Week. Here at CareNational Healthcare, we specialize in the medical management segment of healthcare recruiting, and one of our primary areas being case management. Operating from coast to coast and working with both payer and provider organizations, we have encountered a plethora of different terminology and titles for what are essentially comparable departments, functions, and individual roles. So today we'd like to take a moment to discuss case management and the various titles, terms, and subsets of that discipline.
According to the Case Management Society of America, case management is a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for options and services to meet an individual's and family's comprehensive health needs through communication and available resources to promote quality, cost-effective outcomes. Now, you may be thinking, why so many different terms for what's essentially the same function? Clearly, case management is the most common term, but care management seems to be interchangeable, depending on the organization. On the other hand, we have also seen care management used when referring to direct acute patient care, and not referencing the collaborating coordination process referenced in the definition. To a lesser extent, the terms case coordination and care coordination have been used as synonyms to case management, but more often these coordinator titles refer to a non-clinical person assisting with mostly administrative functions in order to support clinical case managers. There is also complex case management, sometimes called high-risk case management. Usually refers to managing the cases of patients or members that have 2 or more comorbidities. To add a little more confusion to the mix, there are a few specialized subsets of the discipline. Disease management nurses generally specialize in chronic conditions, such as diabetes or asthma, rather than more short-term acute conditions. These nurses are sometimes called health coaches, as they have a focus on overall wellness and health education. Occasionally, health coach refers not to a chronic condition, but to the case management of an individual recovering from an acute condition in a post-discharge setting. Depending on the facility, discharge planning may be a function of the nurse case manager, or it might refer to a specialized role that ensures patients and family members have all the health and resource information they need to reduce the risk of readmissions. Other times, a wellness nurse or health coach specializes in preventative care and measures for an otherwise healthy population of health plan members. This reduces overall costs by ensuring that regular checkups and tests are done before a situation escalates to an acute condition requiring hospitalization. We could continue to muddle these matters by discussing crossovers between utilization management and case management. However, we'll save some of that for our next vlog. We'll see you next time.
We hope you've enjoyed this video. If you have different terms or titles that you've encountered during your work, let us know by leaving a comment below. Thanks for watching. It's Thomas Era, signing off.